I'd like to begin by welcoming you to The Therapy Show, a podcast series dedicated to helping the average person navigate the mental health system. Today, I'm honored to welcome Dr. Sharon Inouye, Professor of Medicine at Harvard Medical School, the Milton and Shirley F. Levy Family Chair and Director of the Aging Brain Center in the Marcus Institute for Aging Research at Hebrew Senior Life. Dr. Inouye is one of the world's leading researchers in the field of geriatric care and has developed a widely used validated assessment tool to identify delirium called the Confusion Assessment Method. Dr. Inouye is widely known for creating the Hospital Elder Life Program, which is commonly referred to as HELP. The mission of HELP is to prevent delirium in hospitalized patients. I have invited Dr. Inouye to discuss the topic of delirium and cognitive decline in the aging. Dr. Inouye, welcome to The Therapy Show.
I'm delighted to be here, Bridget. Thank you so much for inviting me.
Can you start by telling us a little bit about your personal background and professional development that led you to your research in the field of delirium and cognitive decline in the aging?
Well, I'm board certified in internal medicine and geriatric medicine. I also have training as a clinical epidemiologist in public health research. And about 25 years ago, really early on in my career, I became interested in the field of delirium because of observations that I made in the course of my clinical work. Specifically, when I was working in the hospital setting, I saw older adults often becoming confused during the hospitalization, acutely confused. And at that time, when I asked my colleagues and other physicians about this confusional state that I saw, they relayed to me that it was considered to be an inevitable part of hospitalization for some older adults. And I really wondered, did this need to be? Did older adults need to become confused during the course of hospitalization? And that really is what launched me on my delirium research career.
How would you briefly explain delirium and cognitive decline to a non-professional?
I think of delirium as a form of, in air quotes, acute brain failure. And that's to distinguish it from dementia or a more chronic condition like Alzheimer's disease. So delirium, again, is acute. That means it tends to come on suddenly, and it's characterized by the onset of confusion or people being disoriented, not knowing where they are, being confused about what's going on around them. And the other unique thing about a delirium is it tends to occur in the face of acute medical illness, hospitalization, surgery, or intensive care unit stay. So those are some of the settings where you see a delirium very commonly.
Thanks to your research, hospital clinical staff have a way to measure delirium in hospitalized patients. Can you tell my audience about the Confusion Assessment Method, otherwise known as CAM, and how it is used by a multidisciplinary team to indicate if a patient is experiencing delirium and to what degree?
Yeah, so the Confusion Assessment Method, or CAM, I created very early in my career in order to try to identify delirium, as you've said, Bridget. It's designed to be a way that clinicians can make observations in a standardized way. And so it's commonly used by nurses, physicians, or by trained research assistants. And it helps them recognize 4 key features of a delirium at the bedside. And the team members can rate these 4 features using the CAM. And nurses often do it on each shift. And then they can track the scores on the CAM over time to determine if a patient is experiencing delirium and also whether it's getting worse or better.
Many hospitals across the United States have instituted a Hospital Elder Life Program, a program you developed for hospitals to reduce delirium symptoms in hospitalized patients. Can you describe what HELP is and how it works?
Sure. So HELP is an innovative approach that I developed with a team of interdisciplinary professionals. That means a team that included nurses and physical therapists and physicians and pharmacists and social workers and even chaplains to try to help us improve hospital care and the experience of hospital care for older adults. The program's designed to be run by an interdisciplinary team, and the team's assisted by trained volunteers. And the program assures that older adults receive humanistic best care throughout the course of hospitalization and really to attend to special patient needs such as walking, feeding, keeping hydrated, getting sleep, providing regular communication, and also providing fun activities at the bedside, which also help keep people oriented and also provide socialization. The program also provides vision and hearing adaptations, which are very important so patients can see and hear while they're in the hospital.
Can you share a poignant example of a patient experience whose life was made better by help without, of course, giving away any identifying information?
Through the HELP program, we have already served hundreds of thousands of patients around the world. And so there are a lot of stories out there, but I can think of several examples from my own experience. So there was a patient that I remember who had severe rheumatoid arthritis, and I think she was in her mid-70s, and she was suffering from multiple infections in the joints throughout her body because they had gotten infected, and due to her condition of rheumatoid arthritis, she was susceptible to those infections. And so along with antibiotics and all the best experts in the field taking care of her, the HELP team and volunteers worked with the physical therapists to provide active range of motion, which means basically a way to exercise her joints 3 to 5 times every day throughout her hospitalization. And the physical therapists and physicians emphasized to us that this was so important so that her joints wouldn't freeze up with the infections and she would still be able to walk. And with this extra care, she was able to be discharged home independently, and she was able to get back to her gardening within 2 weeks. And she was overjoyed because there was this great fear that she wouldn't be able to do that once she left the hospital. And I remember getting a really wonderful letter addressed to our volunteers from her. There was another patient, just really quickly, who had had multiple episodes of delirium during earlier hospitalizations. It had almost become that the family was expecting every time this patient came in the hospital, he was an older gentleman, that he would just get confused and that there was nothing that could be done. And so when the family learned about our program and the patient was on our program, they relayed to us how concerned they were that this was going to happen again. And every time it happened, it took him weeks to months to recover. And so we told her we were going to do everything we could, the family member, to prevent this delirium. We did our HELP program. We did all the interventions I talked about. And the patient made it through the hospitalization without any delirium or any confusion. And the patient and family were so happy. And I know on subsequent admissions to our hospital, they always made sure that their loved one was on one of the HELP units. So we were very, very grateful about feedback.
The families are so grateful. And also the nurses and the physical therapists and the team, right? Like you have support from these volunteers that come in. It's very exciting to see because I've personally seen it.
That's right. Absolutely. It's just a very exciting program.
What are you most excited about in the field of geriatric research?
So it is a growing field and there's so much to be done. I think if there's one area that I could say that I'm very excited about, it's the potential that intervening and preventing delirium will help to prevent long-term cognitive decline or dementia. And this is a really important and understudied area, just to be able to impact on a patient not going into progressive cognitive decline or dementia, which right now is in many cases felt to be inevitable. I think that's a huge and important area. And if we're able to do that through our healthcare systems, I think it will be an amazing advance for geriatric research.
If you had a magic wand and could improve one thing about the field of geriatric research, what would that be?
Good question. I would love to advocate or try to find ways to improve on funding for aging research. I think in general, it's an area that is really neglected and definitely needs more funding for dedicated research. I think there is a lot of funding going on right now for Alzheimer's disease, which is wonderful and great. But there are so many areas in geriatric research that need more attention. And we can only advance the science and advance our knowledge and understanding through dedicated research. So I'm really hoping that this is something that can happen moving forward.
How can my audience learn more about your work, either online or in print, including if they don't have a HELP program in their hospital, how can they ask for it?
Please find me and my program on my websites. And I have two websites. One is called hospitalalderlifeprogram.org. The other one is called deliriumnetwork.org. So the Hospital Elder Life Program is all about the HELP program. So it's about how to set up a HELP program, about what a HELP program does. It presents some of the key research publications about the HELP program. It has a lot of educational materials for family members, for patients, for clinicians about delirium and what can be done. So that's really our important clinical side. The deliriumnetwork.org website is my research website. And so that talks about a delirium research network that I've created with the help of 12 other principal investigators. And that also has a lot of resources for people interested in learning about how to do delirium research. If people are interested, they can also follow me on Twitter. And my handle is at Sharon _Inouye, and that's spelled INOUYE. And my Twitter feed is really delirium centric. I advance the science of the field, the latest publications, the latest going-ons in the field. It's a very active Twitter feed. And if you want to learn more about delirium, that's the place to be.
And what about if they have a local community hospital and they want their hospital to have help?
Yeah, that's a really good question. So they can bring in information about our website to their hospital. If there's a clinician there that they engage with who would like to learn more, they can reach out to us on our HELP website. There is a number of ways to contact us through the website. There's a direct contact us link. There is a HELP email address. There is a contact us form. So they can get in touch with us in any number of those ways if they want to find out about how to set up a program. If family members or patients themselves want to bring it to the attention of their physician, they can print out pages. We have many published articles they could bring to the hospital setting to see if they would be interested.
So Dr. Inouye, on behalf of myself, my listeners, and all of the people that you've helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand the field of delirium and cognitive decline in the aging.
Well, thank you so much, Bridget. This was really wonderful. And thank you for what you're doing to spread the word about important areas in mental health.
I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so that you, someone you love, and people around the world can gain more benefit from treatment. There is no need to suffer in silence. Get the help that you need to create the life that you want.